Today we'll be addressing a somatic dysfunction in the upper thoracic spine with HVLA. And before we perform any HVLA, we like to prep the area with soft tissue. The soft tissue will be directed at the upper thoracic spine because that is where we will be delivering the thrust. So to prep the area with soft tissue, we'll start with prone pressure in this upper thoracic area. And this soft tissue is a nice preparatory modality for this upper thoracic area, softening those tissues before we perform any thrust. And with HVLA, it is a direct passive technique. Direct in the sense that the restrictive barrier is met directly, and passive in that the patient is not performing any effort. So this area is nice and soft now. So go ahead and flip onto your right side for me. We'll continue with the soft tissue in the upper thoracic area. Again, find those spinous processes coming laterally. And we're just prepping this area, breaking those adhesions, making sure the area is nice and soft, returning blood flow to the area before we perform any thrust. Okay. We will now be addressing the diagnosis of T2, flexed, rotated left, side bent left. In order to perform the HVLA technique, the physician will be standing at the head of the patient. We will go ahead and contact the opposite sides of the patient's head and induce side bending to the right to the T2 segment. I will now go ahead and locate the spinous process of T2 by finding the spine of the scapula and moving to the first spinous process I feel, that being T3, and move up one segment to T2. Now, given the rules of 3, the transverse process will be at the same level as the spinous process. I will go ahead and use my hypothenar eminence to contact the transverse process of T2. Now, with my right hand, I will be contacting the occiput of the patient and providing a rotational direction to the left. Now that I have the tissues distracted, I'll have my patient go ahead and take a deep breath and exhale. And as he exhales, I oppose my hands, and at the end of exhalation, I provide a quick thrust at T2 in an anterior-inferior direction. And then I'll go ahead and return my patient and retest. In order to retest, I would have my patient sit up and straddle the table so that he's nice and secure. I'm going to locate the spine of the scapula and come over to that spinous process, that being T3. I'll move up one segment to T2, and the rules of 3 indicate that the transverse process will be at the same level of T2. And again, testing those transverse processes, they feel symmetric. I'm going to have my patient go ahead and flex forward for me, and stop right there, please. They still feel symmetric, and come back up, and go ahead and look up towards the ceiling, and stop right there. And again, those transverse processes feel symmetric, and you can come back and relax.